The procedure which we are offering here in Harley Street Clinic is keyhole spine surgery. That was not available in England before, and I am the first surgeon who started doing this procedure in England.
For the last 6 to 9 months, I've had chronic back pain. It stemmed from probably the activities I was doing. I was engaged in a lot of boxing. Previously, I used to play a lot of ice hockey, roller hockey. When I would go to the physio, they thought it was just a slight slip disc, so I did the physio to try to promote that and get it back to normal. But what I was finding was progressively over as time went on, my back was getting more and more sore. It went from just being an uncomfortable pain that I would kind of just shift around in my chair to avoid, to becoming unbearable.
This operation is done, or procedure is done for the patient who presented with back pain and leg pain. And if their back pain is not settling down and is crippling patient's life, and he can't walk properly, or he getting numbness in legs or weakness in legs, or even a very severe back pain, and if this pain is due to our disc prolapse, we offer this sort of operation.
My back pain basically was a result of an accident that I had back in April. I was referred to the practice from my physiotherapist. First of all, I went to see Mr. Bangu, who then refers me to Mr. Malik. The pain that I had due to the accident was severe back pain, which I later found out was because of a herniated disc, which also caused me to have pain down my leg due to trapped nerves. On seeing Mr. Malik, he suggested that I have the new procedure.
2 weeks ago to this day, I had surgery. I was in the hospital for only 1 day.
Patient is usually placed in a sleeping position, lateral position, and then under X-ray control, I place the needle into the disc which is causing the problem, and then subsequently we place the camera, which is called the endoscope, and then we watch on a HD monitor, and then we shave off the disc and we decompress the nerve root. And because the patient is awake throughout the operation, we get a direct feedback from the patient. And when you usually stop the operation, when patient says the pain in the leg is completely gone and patient is feeling fine.
6 days ago, I was admitted into the Harley Street Clinic for the procedure. I was taken down to theatre late afternoon. I was given a local anaesthetic. I understand about 2 hours later, everything was over and done with. I was back in my room, virtually pain-free at the time. Looked after very, very well by the nursing staff. I did need some pain relief throughout the night. Had a great night's sleep, which I hadn't had for the past 4 months. Woke up the following morning, had some breakfast, was discharged with some paracetamol and some anti-inflammatories.
I place the needle, so it's only a needle scratch incision, so it does not involve putting any stitch in. And because I don't enter into the spinal canal, I go through the foramina, so I don't disturb any patient's muscles, which can cause a lot of post-operative pain and analgesia. Second, I don't disturb the normal anatomy of the bones. I don't enter into the spinal canal, so the chances of developing any post-operative blood clot or any injury to the neural structure is really very minimal.
The immediate effect was I didn't have any nerve pain. I felt comfortably sitting down, I felt comfortably walking around, there was no pain. There was slight muscle soreness, which is common obviously with these surgeries, but the actual nerve pain was gone, which was immediate relief. After the first week, majority of the muscle pain has gone down. I feel I can move around freely. Simple things I used to do before, or I couldn't do before, such as putting on my socks without pain, now as if there was no issue to begin with. The biggest relief is the fact that I no longer have to fear the thought of bending over or sitting down and cringing at the thought of the pain kicking in, and I feel like I'm back to normal again.
The patient which we have done, I think we have done more than 100 cases now. 97% of the patients, there's complete resolution of the pain.
I'm here now 6 days later, after being back to work for 3 days. And it's totally changed my life. I'm able to do everything, walk down the road without any pain, sit, have the most fantastic night's sleep. I honestly can say the operation was fantastic for me, and I would have it again in a heartbeat. It's given me my life back again.